Hi, my name is Jonathan Modi. I am the communications officer here with the Oregon Public Health Division, and I am joined by Lillian Shirley, the director of the Oregon Public Health Division, and Emily York. She is the coordinator of the Climate and Health program, and we're here to announce the new Climate and Health Resilience Plan. And this announcement is both live streamed, and apologies for the technical difficulties, but we also have the conference line. If those on the line could please mute their lines so we can keep the line clear. And then after we are done with our announcements and presentation, we will open it up again for questions from people on the phone or in the audience, and go from there.
Okay, great.
Okay, so let me turn it over to Lillian Shirley, the director of the Oregon Public Health Division.
Good morning. Thank you for joining us today for the release of the State of Oregon's new Climate and Health Resilience Plan. As Jonathan said, I'm Lillian Shirley, and I am the Director of Public Health for the State of Oregon. And our mission here at the Public Health Division is to promote health and prevent the leading causes of death, disease, and injury in Oregon. We will continue to work toward this mission regardless of what happens at the national level. We will continue to examine the facts and act on those facts to protect the health of Oregonians. Now, 2 years ago, we released our first climate change report. And that was based on the latest climate and health science, as well as observations here in Oregon. We learned what so many health officials are learning across the country, that climate change is a serious threat, not just to our salmon and our forests, but to our people. Our first report analyzed the data and documented that climate change increases health risks right here in Oregon, noting that it's hitting our most vulnerable populations first. Since releasing that report 2 years ago, we observed a series of events, each having health implications with certain populations more at risk. We recorded our hottest year ever, and with this increase in extreme heat events, our syndromic surveillance here at Public Health detected spikes in heat-related illness and death. And we tracked this through emergency room departments across our state in real time. Older adults, low-income households with no air conditioning, people with chronic illness and disease are all more vulnerable to the increasing heat waves we're experiencing. We also saw a record low snowpack in 2015 and 16, with most of our counties declaring drought emergencies and some communities forced to haul drinking water. Our rural communities, who rely on private wells for drinking water, are more at risk, along with our agricultural communities, whose livelihoods rely on a stable climate. And this winter, the governor declared an emergency due to heavy snowstorms statewide, reminding us that we can also expect more extreme precipitation patterns in the years to come. So since releasing that first report, our state experienced the most severe wildfire season in modern history, creating alarming air quality problems that raised the risk of respiratory diseases around our state. Children, outdoor workers, people who are already exposed to air pollutants were at even greater risk. This data shows that climate change is happening here in Oregon, and our health and safety are at risk. A recent assessment of our public health system here in Oregon found that we're currently not equipped to handle these complex environmental issues, that climate change will exacerbate as we go forward. But we're getting a clearer picture of what it's going to take. And this work, our report today, provides a starting place with recommended actions that public health practitioners and our state can start taking today. I'd now like to hand it over to Emily York, and she will tell you a little more about this new resilience plan and its recommendations across the state to make sure we are ready here in Oregon.
Thanks, Lillian. Hi, I'm Emily York. and I've had the honor of working with Lillian and dozens of advisors and partners on the development of this new plan released today. Many programmatic areas of public health were involved, everyone from emergency preparedness to communicable disease prevention, and representatives from other state agencies, local health departments, community-based organizations, and academic institutions all contributed to this project. So we want to thank all of our partners who helped us prioritize strategies that they think will be most effective and actionable here in Oregon. The plan highlights the importance of strategies that can build our resilience to multiple hazards. For example, one of our first priorities is training our public health workforce to integrate climate change considerations into our current public health programming, modernizing our public health system to meet the changing needs of the public we serve. Climate change not only increases risks to our physical health, but also our mental health. We see these as not separate things anymore, and our collective physical and mental well-being are intertwined. When we have resilient individuals, we know that we will be more likely to have resilient communities. And when we have resilient communities, we see better health outcomes. This in turn means higher productivity and innovation across sectors. And it also means that we will have more capacity to adapt to the stressors that may emerge in the years to come. So what can our public health system do to build resilience? What we know is that it's really going to vary from place to place. For instance, our partners on the coast are dealing with a lot of different climate risks than those east of the mountains. Priorities will likely differ between our tribal, rural, urban communities. It's our job at the state's Public Health Division to provide our partners with the tools, the data, technical assistance, and policy change needed to take necessary action to protect our public health. This plan challenges us to find new ways to do that and to support our local leaders in identifying and implementing strategies that are most important in their communities across the state. Luckily, we already have a little bit of momentum on this front, and this momentum is definitely growing. Right now, we have a collaborative of local health jurisdictions who are piloting and evaluating climate and health interventions in various communities across our state. Today, you're going to hear from two local health department directors who have joined us to share examples of this work. And we also have a couple of videos that are part of a series of videos featured on our Public Health Division's YouTube page under a new Climate and Health YouTube playlist. So to start, I'd like to bring your attention to a video that features Muriel DeLaVergne-Brown, Director of Crook County Health Department, who will talk about the work they're doing with partners in Crook County.
Did you know that by 2050 we'll have only about half of our current snowpack? The loss of snowpack negatively affects Oregon in terms of water supply, ecosystem function, crop productivity, forest fire danger, and human health. When I think about climate change, I think about the drought that occurred in Crook County and throughout Oregon this past year. I think about how drought conditions are increasing the likelihood of wildfires, and I think about how these wildfires are affecting our air quality. Poor air quality aggravates cardiovascular and respiratory diseases, it triggers asthma attacks, and can have a long-term effect on lung function, especially among children. Making sure that we have clean air to breathe is an important way that we can protect our community's health, but with climate change, it can be an uphill battle. Thankfully, we're not the only ones working on it. Partners in all sectors and community members of all walks of life are coming together to improve our systems and prepare for the future. When we were working on our climate and health plan back in 2012, a main concern was the lack of our organized community effort around climate change issues here in Crook County. We realized that one of the first steps was to bring diverse groups together to share their ideas on climate change and for us to learn about the current efforts already underway in our community. One effort that followed our planning was the development of a work group through the city of Prineville, and they now have a new air quality action plan.
So we've been working on our air quality with our partners, a number of different agencies, DEQ, the EPA's come forward with some information about our air quality, which is what we're trying to use to gauge our program. And of course, we're working with our health department. It's been an interagency collaboration for about a year and a half, maybe almost 2 years. And we believe our air quality is improved. Our numbers are showing that our air quality is improved. We, of course, have a monitor here in town from the DEQ and one from the EPA, and we track our air quality numbers. The monitors track how much particulate there is in the air, and about 98% of the time our air quality is pretty good. There's a few days of the year when it'll exceed the National Air Quality Standard, and our current program seems to be managing those numbers pretty well.
There is a lot to do, but when we join together with partners, we can have a tremendous collective impact. One of the first steps we can take on climate change is to get involved, whether it be attending meetings, asking questions, or exploring the intersection with our current work. It's so critical that we think about our future and our children's future. The changes are happening as we speak, and it should be a call to action.
And I really feel like this is true. The time to act is really now. And I think this new plan is geared toward those of us working in public health, but everyone in Oregon can take action to build climate resiliency. And I think, community members are really the change agents, and in our respective communities, in our workplaces, in our neighborhoods, speaking about these issues, connecting the dots. And I think it's really important that we have diverse voices being heard from our rural and our urban areas. So the plan emphasizes the importance of strengthening community partnerships and finding solutions that build on our existing capabilities and resources. We as Oregonians are really proud of our natural environment. We understand that the health of our environment is really interconnected with the health of our communities and our local economies. We value clean air and clean water. We understand that our health and our children's health really depends on these basic natural resources. So this is why public health leaders are joining together across the state to ensure that we implement the strategies set forth in the new plan. Thank you.
Thanks, Muriel. We'd now like to show one more video that features Charlie Fautin, Public Health Director in Benton County.
The effects of climate change are a strongly motivating factor for us to pull together partnerships to take action now.
As we started working on the climate change model, critical to our success was working closely with several of our partners. One of those was Oregon State University's Climate Change Research Institute. They were important in helping us to not only look at how climate change is going to be affecting Oregon, but specifically how it might affect Benton County, and looking at how that climate change might affect us 30, 40, 50 years out. Other partners included Good Samaritan Hospital, Public Health, Concerned Citizens, who really helped us to understand and prioritize what those public health concerns would be based on the climate change.
So here in Benton County, we're making sure that in all of our planning, we're addressing the needs of all the population within Benton County with our climate action planning, and that we're involving all programs within public health to make sure we're meeting the needs of everybody within our county. In addition, within chronic disease prevention planning, we find that a lot of the issues are really similar between the two, between climate action planning and chronic disease prevention. And that a lot of the issues that we see with climate action planning will really exacerbate a lot of the existing issues that we see within chronic disease prevention.
From a land use planning perspective here in Benton County, we really see the value of having public health at the table. We approach issues and problem solving as cross-sector collaboration opportunities, and we see health in all policies as an organizing principle for that. An example of that is regarding floodplain, for example, where we might see significant impacts in the future from climate change, and through collaborative efforts cross-sector, we've been able to bring some solutions into this plan, the plan that we've worked on together and then presented to the Board of County Commissioners.
As a county commissioner, I believe the collaboration builds our community's climate resilience. Recent fires and floods show that this is happening here and now, and we have to anticipate catastrophic actions that may occur in the future. It's time for climate action.
As you've heard, public health workers are finding that our partners in many different disciplines are interested in working with us on climate issues. People now understand that climate change is not just an environmental concern, but a threat to human health. Health officials are becoming increasingly concerned about such things as disease vectors, mosquitoes and ticks moving into new areas of the state. We're worried about climate hazards not only increasing the magnitude and frequency of natural disasters, but also some longer-term health implications. For instance, storms and floods cause emergencies and injuries, but even months and years later, people may remain displaced, experience economic hardship, or be exposed to poor indoor air quality due to toxic mold and mildew as a residual of those disasters. Health departments throughout the state are concerned about water security. Around a quarter of Oregonians rely on private wells as their primary source of drinking water. Drought, floods, and other climate conditions pose new risks in the form of floodwater contamination to wells, waterborne diseases, and harmful algal blooms, as well as the potential loss of safe drinking water. Although the public health system currently lacks the capacity to prevent or deal with all of these issues, we're finding success in working with our public and private sector partners to plan and prepare for the long road ahead. Local public health departments are finding that we not only have a role in climate change conversations, but in many cases and in many counties, we're being called on to be the ones convening partners and lead the way. Thank you.
And thank you, Charlie, for that strong encouragement and report on how things are going in Benton County. So we are encouraged by progress we're making across the state. We don't have the answers. We don't have all of them. We don't even know what we don't know at this point. But what we do know is that we have a committed public health workforce and we have partners all across our state. And these partners and workforce and public health understand the science. We see why health matters, and we know when we're making long-term decisions in planning and development in our local communities that we need to consider these factors. We know that people are ready to roll up their sleeves and to work together to ensure clean air, clean water, a secure food system, and a stable climate for our children and grandchildren. So with this kind of momentum in our state, no matter what happens at the national level, together we will continue to make great strides in keeping Oregon green, healthy, and safe. Thank you.